Welcome to the series of instruments in human physiology. Now I am introducing a very simple and important instrument for the physician. It's vital for the physician. That is stethoscope. So I think all have seen stethoscope and this about the stethoscope. This stethoscope is used by the physician to evaluate the sounds inside the body which cannot be heard by the human ear. So in the first initial stage, when the physician was examining the patient, he was using a rod. So from keeping from the ear of physician to the chest of the patient, and in the coming years it was modified, and this model was introduced by Laennec. It is in 1819. This model came into form in 1819 and was introduced by a French physiologist, Laennec. So I will say about the major parts of this stethoscope. So you have seen the stethoscope. So this stethoscope is having 4 major regions. So first one, that is earpiece. So 2 earpiece, you can see earpiece. Then there is 2 things, that is binaurals. It is called as binaurals. Then one long tubing we call it, and the end portion you can see one chest piece. So the name itself implies that it is the piece attached to the, we are keeping over the chest region. So this is the 4 regions, 4 parts of the stethoscope. So starting with the earpiece, so it is understood that this part we have to fit to the ear, and ending with the chest piece, so that this is kept over the chest region. In between connection is there for these 2 parts. So coming to each part. So first part is that earpiece. So earpiece, peculiarity is that it is a rubber thing. It is attached over the steel rod. So it is flexible. And also to note the point is that this is having a special shape, and this part fits to the ear region. So it is in the way convenient to fit to the ear canal. So that shape is made in that way. Here see that this should fit to the ear facing the face forward and medial side, and the face and the forward position to the face. So this is the proper way. So when you are keeping like this, you see the ankle, that is it is forward, and this curve is medial side. When coming, if you are keeping like this, the curve is in the facing the posterior side of the face. So this is not the correct position. The correct position is that this earpiece should fit to the ear canal, ear hole, and that should be this tip of the earpiece should point forward and medially and forward. So this is the correct position to fit to the ear. So keep the stethoscope like this and see whether the tip of the earpiece is pointing forward to the face portion. If it is opposite, that is, it is the curve is to the posterior, so that is not the correct position. When you are fitting, it won't be comfort for you. So the correct position is that the ear tip, the tip of the earpiece should face forward to the face region. So it is clear, I think. Then this is a rubber part fitting to the ear canal. So this is called as a earpiece. Then joining to this third part, that is tube or rubber tube we can call. So 2 steel rod is there. In the end there is one rubber attachment. So this 2, that is connecting to the ear canal, auricle or ear or auricle. So we call it as binaurals. Binaurals, B-I-N-A-U-R-A-L-S. Bi means 2 connecting to the 2 ears. Then third portion, that is a tubing, we call it as tubing. So tubing, it is also flexible rubber tube, and its approximate length is 30 to 40 centimeters. Then the last fourth part, that is the main part, it is called as chest piece. So see, it is divided into two parts, two rounds you can see, one small round and one big round. So this small round, that is a bowl shape, is there some little depression is there, so it is a bowl shape, we call bowl shape with a hole, and this is covered, this circle is covered by rubber ring. See, you can see that with a bowl shaped circular covered with a rubber ring. So this is called as bell chest piece, bell, and this is for evaluating the low pitch sounds. Coming to the opposite part, that is a flat round circular portion, flat one, it is called as a chest piece. We keep this area over the chest region to palpate, to auscultate the heart sounds, to get the heart sounds. And this circular part is covered by a steel or a plastic covering. Instead of this rubber, there is a steel or a plastic covering. And this is flat portion, and for high pitch sounds we are keeping, to get the high pitch sound we are keeping this portion, using this portion. So this is kept over the chest, that's why it is called as chest piece. This is called as bell chest piece. So this is called as diaphragm chest piece. So chest piece is having two parts, diaphragm, which is a flat chest, flat portion, and the bell, that is a bowl shaped portion. Bell chest piece, diaphragm chest piece. And the last point is that you have to see whether it is in the working functioning position or not. To see, check the position of the stethoscope, you have to just rotate it. So here there is one rotating thing, just rotate the rubber end. So you can hear a click sound. So hearing the click sound, just keep the stethoscope over the ear and just give a tap. So if it is not sound is not coming, it is not in the working position. Just gentle tap you give it and sound is heard here, then it is in the working position. So that is about this stethoscope. So here remember that, lastly I am summarizing this, remember that when you are keeping the stethoscope in the ear, remember that the ear tip should point forward, not backward. So that is the correct position. And also before starting, see whether it is on or off position by just rotating and getting a click sound. Tap over here and check it whether it is in the on or off position and do the auscultation. So this is all about the stethoscope. Thank you.